Hello, my name is Kate Workman, and I am a second-year medical student at Oakland University School of Medicine, working with Dr. Day at Henry Ford in orthopedics. And I will be presenting today about value in total knee arthroplasties. So, in general, value is becoming a much more common metric as it takes into account cost and quality in result to patient care due to the increasing healthcare costs in the United States. So, for this project specifically, I was looking at how total knee arthroplasties performed in a healthcare outpatient department, or HOPD, compares to the ambulatory surgical center, or ASC. This is an especially important topic as it is becoming increasingly popular to provide, especially joint replacement surgeries in ASCs. So our hypothesis was that conventional TKAs performed in the ASC will have a higher value compared to those performed in the HOPD setting. So for this study, we recruited 40 patients undergoing conventional, so non-robotic TKA surgeries. 16 of those patients were at the ambulatory surgical center, and 24 of them were at the HOPD. So in order to determine value, first we had to look at cost. And so in order to determine the cost, we used four different variables. Our direct variable labor costs, which is determined using a common method, the TD-ABC, time-driven activity-based costing, which utilizes all the salary of the people at the hospital providing direct care to the patient, accounting for the length of time that they care for the patient. So not just surgeons and nurses, but also like the radiology techs, the physical therapy department, all of those times for, during the surgery, pre-op, post-op, that kind of thing. So next we looked at direct variable supply. These were just the supplies that you use, for the procedure. And then we looked at direct fixed costs, which include just the operation of the facility, and indirect costs for things that kind of have to happen but aren't necessarily like directly related to the patient, such as things like administrative tasks. So for our quality aspect of value, we used what's called the Coos Junior score, which is the knee injury and osteoarthritis outcome score for joint replacements. This is a common metric used by orthopedic surgeons in order to see how patients are doing, kind of pre-op, post-op, and just to, gauge their joint symptoms. And so for our value calculation, we used that metric and adjusted it for life years, including things like life expectancy and also the implant's average length of effectiveness, in order to standardize our information. And that gave us our CALI score. So for the value of each surgery, we measured that with what's called an ACER, which includes the cost for those variables we just talked about divided by the CALI. And so a lower ACER means that there is greater value to the procedure. So for our first figure here, I have a breakdown of, in that first column, the HOPD total cost versus the ASC total cost. Now, this is where we found our statistically significant difference really between these two locations. So cost at the HOPD, you can see on average was $30,000, whereas for the ASC, it's $20,000. So there is a statistically significant cost difference between these two options, with the ASC being the cheaper option. Now, when we look at outcomes, and just like the quality, our quality of care metrics, there was no statistical difference between in the HOPD or the ASC. They were both found to be equally effective. In this chart here, you can see here is our zero line, and so on this side are any surgeries that had, like a lower outcome versus the better outcomes on this side. And you can tell that most of our data points all are positive outcomes. And you can see here how the higher cost of the surgery is up in this part of the graph, whereas most of these are the blue HOPD dots, whereas down here, the more of these orange colored data points, that is for our lower cost ASC procedures. And so Overall, we found that the shift to value-based care is something that should be explored further and is important in order to be able to combat some of these rising healthcare costs while not sacrificing quality. Thank you so much for listening to my talk.